Hello, this is Dr. Matthew Andrews. I'm the program director for the McLaren Macomb Hospital Residency Program. This is an update video that we've been sending out on an annual basis just to give all of our potential candidates for interview and any students who may be interested in our program just a bit of a snapshot into our program, what's new since last year, and to kind of help answer some questions prior to the centralized interview process, which is in Frisco, Texas, in about a month from the date of this video. And my contact information is at the end too, so you're certainly more than welcome to contact me or our chief residents with any questions you may have about the program prior. Unfortunately, with lockdown restrictions and post-COVID era upon us, we're unable to have student visitors to the hospital unless you're on an actual rotation. However, we can arrange for clinic visits and things like that to occur, so at least you get a flavor of the program and some of the residents that we train here. So our core faculty group is myself, Dr. Stacy Miller, who is a wound specialist and works in the wound center within the hospital. Kristen Patterson, who is an active surgeon with our group and is moving into an office across the street from the hospital. That building is still under construction. And Dr. Carl Dunn, who is a fellowship-trained foot and ankle surgeon who does a very high volume of procedures and is kind of the king of Lansing. Our residents do spend some time in Lansing, typically a month at a time as senior residents with Dr. Dunn, who does a good amount of cases with us. And between the rear foot procedures that he does and the rear foot procedures that I do, our residents get a very strong feel and excellent training, particularly in some more high-end procedures that we see in the wide world of podiatry. So myself, I'm an alumni of this program myself. I graduated from this program in 2014. I was a little bit older when I started podiatry school. I was 27 when I started at Scholl many years ago. I was the assistant program director for 6 years, then I took over in the middle of the pandemic in 2020. And we've been able to not only salvage this program, but also really turn it into an excellent, kind of a high-power academic program over the past couple of years that we were able to transition to McLaren, and then I've been running the show here. So I am board certified, and I am also had the opportunity to become a content writer for the American Board of Foot and Ankle Surgery. So I write questions for the didactic exams and also for the lead assessment, which is for board certified individuals that have to take the continuous certification questions on a quarterly basis. So I am currently involved in a fellowship program in medical education through Michigan State University. They have what's called the Office of Medical Education Research and Development. So I'm in a cohort group of about 12 other physicians and clinical psychiatrists and psychologists that are involved in medical education. So that's a great program that really helps you to kind of hone in on the pedagogical approach to medical education, which is a very dynamic field. I am in private practice. I still see patients 2 days a week. I'm in the OR 2 days a week at McLaren as well. So Mondays and Thursdays are my block days. Currently, I'm also serving as a medical director for a large group. So I do a lot of business and administrative type work. And I am prior service military as well. I was in the Army for several years, which is one of the reasons why I started podiatry school at 27, as opposed to most folks that will come right out of college and go right to podiatric medical schools. So the hospital itself, nothing's really changed in the past year. We're a 288-bed hospital. We are a level 2 trauma center. We do see a fairly good amount of trauma that comes through our emergency department, which is quite large. We have a new ER and graduate medical education center, which was completed in 2020. We have about 120 residents in 8 residency programs. So we have programs in family medicine, internal medicine. We have a fellowship program in cardiology, urology, orthopedics, OB-GYN. So we have several training programs with an excellent graduate medical education department. Our coordinator Roman is second to none. He's fantastic and very organized. We also have a new outpatient surgery center and medical office building that's under construction. The building itself is complete. They're doing a lot of the finished carpentry and internal work, which does include a 4 OR suite surgery center that will be opening in the spring of 23. So for our interviewing students, by the time that you graduate, this facility will be up and functional, and will be an additional 4 ORs in addition to the 14 ORs that we already have over at the hospital itself. So in the past year, we have had the addition of some training sites. And we also have included a behavioral health facility and rotation as well. We have a senior behavioral health center that we do provide coverage for, which is in Shelby Township, so about 7 or 8 miles away from the actual hospital itself. The Graduate Medical Education Department is pioneering a lifestyle medicine curriculum, which is a adjunct curricular educational development pathway for residents, not only in surgical disciplines, but also for internal medicine and family medicine as well. So you can get certified in lifestyle medicine throughout the duration of your residency training. And we also, like I mentioned before, we do have the new Harrington building with the surgery center that's going up across the street. So surgery case coverage, our coverage remains largely the same. We cover the hospital, of course. We also have residents that will spend time at Premier Surgery Center in Clinton Township, where I still do maybe about 5 to 10% of my procedures. Insight Surgical Hospital in Warren, which is the old Kern Hospital. We still cover a fair amount of cases there. Surgeon's Choice Medical Center in Southfield. We still have access to the Detroit VA. However, we've been quite busy and understaffed for the past couple of years, so we haven't been able to service the VA. And I'd like to go ahead and reactivate that rotation with the addition of a couple new residents this coming academic year. We also cover, or have the capacity to cover, a couple of the McLaren facilities out of the McLaren umbrella, and also Lake Surgery Center in Commerce Township, which is in the northwest suburbs of Detroit. Some of the highlights of our program, we are and continue to be the oldest continually running program in the country. So this was the original. So we have quite a lineage of esteemed practitioners who have come before us, and many who have gone on to become deans of podiatric medical schools, pioneers in research, and of course we have a vast network of surgeons across the country. So which is very beneficial, because if you're looking for a job someday, even when I was a resident, I remember I had people offering me positions all over the place: Delaware, New York, Florida. Hey, where would you like to go? So we have a great alumni network. It's a very collegial with a lot of great opportunities for our graduates. We do get a fair amount of practice management experience with our resident clinic. And also resident rotations in private offices. We have a well above average case volume. Currently, this is not even halfway through the academic year, and all of the second year residents are completely finished with their volume and diversity. So our number requirements for our second year residents are being eclipsed, not even halfway through their training. So we're doing very, very good from a volume standpoint. We do have access to a morgue at the hospital. We have a number of vendors that do provide labs and workshops. One of the benefits of being in Southeast Michigan is that there are multiple residency programs here. So a lot of our vendors, such as Arthrex or Stryker or Paragon 28, they have laboratory facilities that they allow us to come in and either do cadaver procedures or familiarization with some of their instruments and equipment. We have collaboration with other McLaren facilities and with Michigan State University. We've got access to online resources, access to libraries, access to the Institutional Review Board, or IRB, through Michigan State as well. And then we have some in-house support both at the corporate level with McLaren and also locally for research support. We literally have a number of quality improvement research projects that are just teed up for residents to just take and run with. So as far as developing research projects and your research requirements in residency, we make these things about as easy as possible. I added this slide, just update this year, just because I wanted to see folks to see that we do a very, very wide variety of procedures, and we have a lot of diversity in our surgical training. So some of the featured procedures that we do in this program, I've put number 1, ankle arthroscopy, just because by volume, this is probably the most common procedure that I do. So I see a lot of ankle instability, ankle arthritis, people with just chronic capsulitis or other structural problems with the ankle. And I do a fair amount of ankle scopes. I do probably a couple a month. So this is one of the more frequent procedures that we see. I also get referred a lot of Charcot procedures. Not really necessarily by choice, but it's something that I've developed quite a talent for. So we do get a lot that does get referred to us, and we see some of the worst of the worst. And as part of that, we do a lot of basic Charcot procedures like lumps and bumps or planing, but a lot of reconstructive type procedures as well, involving the use of internal and external fixation constructs. We do a fairly good amount of elective forefoot and rear foot cases, so flat foot corrections, tendon repairs, bunions and hammer toes, neuromas, procedures like that. I do peripheral nerve surgery as well. I do a procedure called a Dell and triple nerve release, which is well defined in the literature, and we have pretty good results with it for refractory neuropathy. So it's something that I and my practices do advertise. And it's a procedure that we do a handful of times a year. Ankle stabilizations, again, that's like an adjunct procedure to a lot of arthroscopy. Subchondroplasty procedures as well. I think this is an underutilized modality in foot and ankle surgery. Subchondroplasty is a fantastic procedure to alleviate marrow edema lesions within bone that are identified in MRI for chronic pain sufferers. We do, between myself and Dr. Dunn in Lansing, and Dr. Patterson and Dr. Murphy, who also do a fair amount of procedures at our hospital, our residents probably see more ankle replacement procedures, probably the most in Michigan. I can't lay a specific claim to that, but we do a fair amount, so it will be a procedure should you choose to do some more these more esoteric rear foot procedures upon finishing your training. We'll have a good experience to be able to support you in that. We are an academics first program. We do have morning conference twice a week, 6:30 a.m. Right now it's Tuesdays and Wednesdays. So Tuesdays we have an in-person lecture, and Wednesday we have a hybrid, either in person or through Zoom, radiology rounds, case presentations. We do it through Zoom because it's a lot easier to sit there and pull up an MRI, for example, on a computer, and then we just go through the MRIs with everybody. So, but generally Tuesdays at 6:30, we reserve that time for structured academics. And that's generally an hour-long lecture. We do monthly journal review where we go through an entire serial of a journal where we review anywhere 20 to 30 articles depending on the month, depending on the journal, with in-depth discussion about research methods, levels of evidence, and applicability to foot and ankle surgery. We also have a monthly social journal club, which is typically the last Wednesday of the month. We have McLaren review, which is structured by the residents weekly. We've got a lot of resources available at our library. We have pretty much any textbook that we can find regarding foot and ankle surgery, or even beyond, orthopedic texts and things like that. That's one of the benefits of having a great GME program. We have great library support. We're able to get PDF copies of many of these texts, as well as a lot of board prep software like Board Vitals and Board Wizards and things like that. I mentioned previously that we do have active research staff. We have a dedicated research professional that really kind of tees up research projects, either quality improvement projects or things that may be IRB worthy based upon human subjects. But we also do a fair amount of case reports and things like that as well. Being a McLaren resident also comes with an adjunct faculty appointment to Michigan State University. So should you choose a career in academics, you will start with academic rank just by being a part of this program. And our program, our academic program is really geared more towards passage of the ABFAS exams. I've been through the board certification process with ABFAS. I'm now a content writer for ABFAS. These are difficult exams. There's a methodology with how to take them, and there is, really this is kind of the pinnacle of surgical achievement for a surgical residency. And these are exams that have characteristically not great passage rates in podiatry. So our goal is to prepare you as best as possible for these exams, not only from a medical knowledge standpoint, but also from a functional knowledge standpoint. So who are we looking for? I'm looking for residents that are essentially self-motivated, somebody that doesn't need to be told what to do all the time, somebody that can really kind of serve almost as a leader from day one. We also strongly enforce getting the knife in your hand on day one. So you're going to come in as a first-year resident. You're going to be doing things in the OR immediately. So you're going to be logging cases, you're going to be getting your hands dirty, you're going to be doing a good amount of procedures and suturing almost from the get-go. So I feel that doing that early on in the education pathway leads to a lot better confidence in the operating room. And then when we have our clinical competency discussions with our core faculty group, that's one of the things that always comes up, is that our residents are head and shoulders above residents from other programs with regards to their surgical skills and prowess in the operating room. We're also looking for residents that will be a good advocate for our program and off-service rotations. When you are in the ER, when you're on general surgery, when you're on vascular surgery, when you're on the medicine service or infectious disease or pathology, you're an advocate for this program, and you're an advocate for podiatry. And one of the best ways that we develop relationships with our peers and colleagues is really just by being eager and being enthusiastic while you're not on podiatry, while you're doing other off-service rotations. So that's the type of candidate we're looking for. Interviews this year, the centralized interviews. Our interview day is Sunday, January 15th in Frisco, Texas. It is a mixed academic and social interview. Our interviews are relatively low pressure. We'll show you some academic scenarios, and really we just want to see how you work your way through a problem. There's not necessarily right or wrong answers to a lot of my questions. I really just want to see, how your wheels turn, how you work up a patient, how you approach a surgical problem. Following centralized interviews, we will be doing Zoom interviews as well on an as-needed basis, which will be scheduled. So that's something that will be coordinated through Roman, our coordinator. Here's his contact information as well, his email address. If you have any questions, by all means, feel free to email myself, our incoming chief for next year, Marwa Hamadi. She's a fantastic resource as well. Or our current chief resident, Dr. Adam Hotchkiss, is also available if you have any questions whatsoever regarding the program, regarding quality of life for residents, what's it like to live in this area, or anything that you can conceive of. So. Otherwise, we look forward to seeing our interviewees in Texas. And if you have any questions about the program, feel free to reach out.